Today, we're diving into a really fascinating topic, fractal dimension analysis. Now, that sounds complex, but it boils down to a pretty straightforward question. Can we use the intricate patterns of fractal geometry to get better and more objective at diagnosing skin cancer?
And this really gets to the heart of the clinical challenge. I mean, to the naked eye, a completely harmless mole and a very dangerous melanoma can look remarkably similar. It's this visual ambiguity that really drives the need for objective, non-invasive tools that can see beyond what our own eyes can.
So, a potential solution is to shift away from that subjective visual assessment and move toward a solid mathematical framework, something that can actually quantify, put a number on, the structural complexity of these lesions. And this is precisely where fractal dimension analysis emerges as a potentially powerful tool. So what exactly is fractal dimension? Well, you can think of it simply as a measure of complexity. You know, in standard geometry, a line has one dimension, a square has two. It's pretty simple. But fractal dimension uses fractions to describe just how much detail and irregularity a shape has as you zoom in closer and closer. This slide does a perfect job of illustrating a key and maybe a little counterintuitive concept. A simple square has a fractal dimension of exactly 2. But the incredibly intricate Sierpinski carpet actually has a lower FD, about 1.89. So for our purposes, the main takeaway is this. The more irregular and complex a lesion's border is, the lower its fractal dimension. That's a crucial idea we're going to come back to. All right, here's a quick roadmap of where we're going. We'll start with a diagnostic challenge, then we'll unpack the methodology of fractal analysis. We'll review the key findings for both shape and texture, see why polarized light is so important, and finally, we'll look ahead to the future of automated diagnosis.
Okay, first, let's clearly define the lesions we're trying to differentiate, because getting this right is absolutely critical for patient outcomes.
We're looking at 3 main types here. First, benign nevi. These are your common moles, usually harmless. Then you have dysplastic nevi, which are an intermediate type and a key risk factor for melanoma. And finally, there's melanoma itself. It's rare, but it's aggressive, and it's responsible for most skin cancer deaths. The problem is, right now the gold standard for diagnosis requires cutting out the lesion for a biopsy, which is an invasive and often stressful procedure. So how do we actually take a clinical photograph and get it ready for this kind of mathematical analysis? Let's walk through the methodology. The image processing follows a very systematic 5-step workflow. First, high-res images are taken under both non-polarized and polarized light. Then, those color images are converted to grayscale. After that, a tone-inverted copy is made and stacked with the original. Finally, a special algorithm isolates the lesion completely, giving us a clean, crisp image that's ready for analysis.
All right, now we're getting to the core findings. How well does this method actually differentiate these lesions when you analyze the fractal dimension of their shape and their texture?
This first major finding is a potential game changer. The fractal dimension of a lesion's shape, when it's viewed under polarized light, is powerful enough to statistically tell the difference between all 3 lesion types, melanomas, dysplastic nevi, and benign nevi. This table really gives us the statistical proof. These are the p-values, which measure the probability that what you're seeing is just due to random chance. A value under 0.05 is considered significant, and as you can see, these values are incredibly low. This provides strong evidence that the differences in fractal dimension between these groups are real and meaningful. So here's a quick summary. For the lesion's shape, polarized light can separate all 3 types. For its texture, it can pick out melanomas from the other 2. The really key takeaway, though, is how much non-polarized light consistently underperforms. I mean, for texture analysis, it couldn't find any significant difference at all. And that brings us to a really crucial aspect of this whole methodology, the clear, demonstrable superiority of using polarized light for capturing the images in the first place. And when you look at them side by side, it's pretty easy to see why. The image on the right, taken with polarized light, has much higher contrast and a sharper, more clearly defined border. That extra clarity provides much better data for the fractal analysis, and you can see that reflected in the lower, more complex FD value. The data on this chart just confirms what we saw visually. For every single lesion type, the average fractal dimension is lower when using polarized light. This is the measurable proof that polarized light is just superior at capturing all those complex, irregular details that you need for an accurate diagnosis. Now, the crucial thing here is that this technical finding has direct clinical consequences. You see, better imaging leads to better analysis, and by more accurately defining a lesion's true borders, surgeons can plan more effectively, which could reduce the risk of what's called incomplete resections. That's where some cancerous cells are accidentally left behind.
Okay, finally, let's zoom out and look at the bigger picture here. What does all this mean for the future of automated, computer-aided diagnosis? An interesting finding emerged when they compared the fractal dimension to the lesion's actual size. For melanomas and dysplastic nevi, there was no connection. But for the benign nevi, something fascinating appeared, a significant negative correlation. And it's a strong correlation, too, at negative 0.72 under polarized light. So what this suggests is that as benign moles get bigger, their borders actually become simpler and more regular. That's an objective trait that could be a very valuable input for any diagnostic algorithm. You know, maybe the most powerful finding of all is that this analysis is sensitive enough to differentiate between the different stages of melanoma. The ability to distinguish a non-invasive in situ melanoma from a more dangerous invasive one without a biopsy could have profound implications for planning treatments and predicting outcomes. Ultimately, what this research shows is that fractal dimensions of shape and texture are objective, measurable, and reproducible. They're exactly the kind of operator-independent data we need to power the next generation of automated, computer-based diagnostic systems. And that leaves us with a final question to consider. As analytical methods like this are refined, are we going to see a paradigm shift in diagnosis? A move away from the subjective art of visual interpretation and towards the objective science of mathematical quantification? The potential to improve diagnostic accuracy and patient outcomes is certainly compelling.